Hi Vaishak. Hi Rocking Rons. Hi Ashina, Yedu, Anju. Good evening Abhirami. Long back looking Abhirami. സുഖാണ് അഭിരാമി. ഇവരൊക്കെ ഞാൻ ഇടയ്ക്ക് കാണാറുള്ളതാണ്. അഞ്ജുനെ, അശ്വിനെ, യദുവിനെ ഒക്കെ. അഭിരാമി പഠിച്ച് കംപ്ലീറ്റ് ചെയ്തോ? ദേ ഇത്തിരി ദിവസങ്ങൾ കൂടിയല്ലേ ഉള്ളൂ. എന്താ വട്ടം ഒന്നും കംപ്ലീറ്റ് ചെയ്യായിരുന്നു? ഒത്തിരി സമയം കിട്ടിയത് കൊണ്ടാണോ? അശ്വിൻ പഠിച്ചു കഴിഞ്ഞോ? യദുവോ? അങ്ങനെയൊന്നും പറയല്ലേ. ലാസ്റ്റ് ഇയർ ആണ്, സമയമില്ല. എങ്ങനെയെങ്കിലും കംപ്ലീറ്റ് ചെയ്തേ മതിയാവും. എങ്ങനെയെങ്കിലും കംപ്ലീറ്റ് ചെയ്യുക. കമ്പൈൻ സ്റ്റഡിയോ അങ്ങനെ എന്തെങ്കിലും ചെയ്തിട്ട് പഠിച്ചവർ ഇതായി കൊടുക്കുക. ഹായ് അശ്വതി. ആഹാ, ഇതാര് വർഷയോ? കമ്പൈൻ സ്റ്റഡി ചെയ്ത്. കാരണം അഭിരാമി എന്താ ഇത് ക്യാച്ച് ചെയ്യാൻ ഓൾറെഡി അറിയാലോ. നമുക്ക് പെട്ടെന്ന് ക്യാച്ച് ചെയ്യാൻ ബുദ്ധിമുട്ടുള്ളവരൊക്കെ ഉണ്ടാവും, അത് കേട്ടിട്ടും ഇതാക്കാനും ഒക്കെ. പക്ഷെ നിങ്ങൾ കമ്പൈൻ സ്റ്റഡി ചെയ്തിട്ടുണ്ടെന്ന് വിചാരിച്ചാൽ എന്തായിട്ടുണ്ടെങ്കിലും അത് ഒരുപാട് പേർക്ക് ഹെൽപ്പാവും. അക്ഷയ, കാവ്യ, നിങ്ങളൊക്കെ നെയിം കേൾക്കുന്നവർ എന്തൊരു ഭയങ്കര സന്തോഷം. ആർദ്ര, ഞാൻ കഴിഞ്ഞൊരു ദിവസം ആർദ്രയുടെ ഒരു ഡാൻസ് കണ്ടായിരുന്നു കേട്ടോ. ഇങ്ങനെ ഞാൻ സ്റ്റാർട്ട് ചെയ്തോട്ടെ. ചെറിയ രീതിയിൽ, വലിയ ഇലാബറേറ്റ് ആയിട്ടൊന്നും അല്ല, ചെറിയ രീതിയിൽ. ഇത് നമ്മുടെ ഗാനം എന്തിയേ? ആർദ്രെ ഗാനം എന്തോ എടുക്കുക? ഗാനം എവിടെ പോയി? ആഹാ, ഇത്ര പെട്ടെന്ന് ഉറങ്ങിയോ? വിളിച്ചുണർത്ത് കാവ്യശ്രീ. ഓൾമോസ്റ്റ് എല്ലാവരും ഉറങ്ങുന്ന സമയമായിട്ടുണ്ടാവാം. ഹായ് സ്നേഹ. അതെയോ? ഷോ, എൻ്റെ ഗാനയ്ക്ക് റേഞ്ച് ഇല്ലെന്നൊക്കെ അവർ പറയുന്നു. ഗാനെ പെട്ടെന്ന് റേഞ്ച് പോയതാണോ? ഹായ് ടിജിൻ. ഓക്കെ, ഞാൻ എന്താ ഡീറ്റെയിൽഡ് ആയിട്ടൊന്നും ഇതാക്കുന്നില്ല. ജസ്റ്റ് നിങ്ങൾ പറഞ്ഞ് ആ ഒരു പോർഷൻസിൻ്റെ ചെറിയൊരു ഇത് മാത്രമേ ഉള്ളൂ. ഹായ് ടിജിൻ. ടിജിൻ ഇപ്പോഴും പാട്ടൊക്കെ പാടാറുണ്ടോ? എൻ്റെ വോയിസ് ഓഡിബിൾ ആണല്ലോ. ഞാൻ സ്മൂളിലൊന്നും ഇല്ല ടിജിനെ, അതുകൊണ്ട് പിന്നെ ഞാൻ കേൾക്കാറില്ല. അക്ഷയ് നിമിഷ. ഹായ്. അക്ഷയെ കണ്ടിട്ട് ഒരുപാടായി, അല്ലെങ്കിൽ അക്ഷയെ എവിടെന്നെങ്കിലുമൊക്കെ ആരുടെങ്കിലുമൊക്കെ സ്റ്റാറ്റസിലൊക്കെ കാണാറുണ്ടായിരുന്നു. അക്ഷയ. വർഷ ഉറങ്ങാണോ? ഓക്കെ, ചെറിയ രീതിയിൽ ജസ്റ്റ് എങ്ങനെ മനസ്സിലാക്കാം എന്നൊരു നോട്ട് മാത്രമാണ്. ഓക്കെ, ഇത് ജസ്റ്റ് ഓർമ്മ വെച്ചിട്ടുണ്ടെങ്കിൽ എഴുതാം എന്നുള്ളൊരു രീതിയിലാണ്, ഡീറ്റെയിൽഡ് ആയിട്ടൊന്നും അല്ല നോട്ട് വരുന്നത്. ഓൾറെഡി വി ഡിസ്കസ്ഡ് അബൌട്ട് ദ ലാബർ. ഓക്കെ, കണ്ടിന്യൂഷൻ ഓഫ് ദ ലാബർ. വി വാണ്ട് ടു ചെക്ക് ലിറ്റിൽ ബിറ്റ് തിങ്സ്. ദാറ്റ്സ് ഓൾ ഓൺലി ഐ എം ഗോയിങ് ടു ഡിസ്കസിങ്. ഓക്കെ, നമ്മൾ ഓൾറെഡി ഡിസ്കസ് ചെയ്തൊരു പോർഷനായിരുന്നു ലേബർ, അതിൻ്റെ സ്റ്റേജസ്, പ്ലാസെൻഡ, സ്ട്രക്ചർ, അങ്ങനെ കുറേ കാര്യങ്ങൾ ഓൾറെഡി ഡിസ്കസ് ചെയ്തായിരുന്നു. അതിൻ്റെ കൂടെയായിട്ട് എൻ്റെ വോയിസ് ഓഡിബിൾ അല്ലേ? വോയിസ് ഓഡിബിൾ ആണോ? വോയിസ് ഓഡിബിൾ അല്ലേ? ടിജിന് എൻ്റെ വോയിസ് കേൾക്കാൻ പറ്റുന്നുണ്ടോ? ഓക്കേടാ. ഓക്കെ, ഹായ് അബിൻ. ഓക്കെ, നമ്മൾ ഓൾറെഡി ലാബർ ഡിസ്കസ് ചെയ്തായിരുന്നു. നിങ്ങൾ ലാബർ കണ്ടിട്ടുണ്ട് എന്ന് ഞാൻ വിശ്വസിക്കുന്നു. അപ്പോൾ അതിൻ്റെ ഹായ് ശ്രുതി, ഹായ് അബിൻ. ഓക്കെ, നമുക്ക് ക്ലാസ്സിന് ശേഷം പോവാം. പെട്ടെന്ന് നിങ്ങൾക്കൊരു അറിയാവുന്ന രീതിയിൽ എങ്ങനെ എഴുതാൻ പറ്റും എന്നുള്ള രീതിയിലൊന്ന് ഞാൻ പറഞ്ഞുതരാം. ഓക്കെ, ജസ്റ്റ് കേട്ടിരിക്കുക, അത്രയും മതി. കേട്ടിരുന്നിട്ട് മൈൻഡിൽ എന്താണോ കയറുന്നത് അത്രയും നോക്കിയാൽ മതി. ചൈൽഡ് ബർത്ത്. The childbirth is the process of delivering a baby and a placenta, membranes and umbilical cord from the uterus to the vagina to the outside world. That's we call as a labor or childbirth. The process of delivering a baby and placenta, membranes and umbilical cord. Not only a single one. Okay, it is a process of delivering. Okay, process of delivering. What is the thing is delivering? Three things are there. First one is the baby, then placenta, membranes and umbilical cord. All the things will come from inside to outside. The process of delivering a baby and placenta, membranes and umbilical cord from the uterus to the vagina to the outside world. From inside the uterus, what all things will come out means, let's say first one is a baby, then placenta, membranes and umbilical cord. Normally we know first baby is delivery, then after placenta and umbilical cord. Continuation of that one. That is the thing only is the labor or the childbirth. Okay. In here the labor we are divided into three stages. First stage, second stage and third stage. In these three stage wise only the process is going on. Not a single step but three steps wise. One is a first stage, second stage and third stage. That is the three stages of labor. The labor or childbirth, it is a process of delivering a baby and placenta and membranes and umbilical cord from the uterus to the vagina to the outside world. So that's come out. And this process is in the three stages. First stage, second stage and third stage. Okay. In here, first we can move to first stage. Okay. First stage again we divided into two. Latent phase and active phase. Okay. Labor process divided into three stages. First stage, second stage and third stage. Again the first stage divided into two. Latent phase and active phase. That means the cervix dilates fully to the diameter of about 10 centimeter. Okay, the first stage process. The first stage process, what is the process of the first stage means the cervix is dilated fully. The cervix dilated fully to the diameter of about 10 centimeter or 2 inches. Okay, that much the dilation occurring, the process is going on in the first stage. That's a common thing only. The three stages are there, first, second and third. In first, second, third, first one is the first one. Okay, the first stage again we divided into latent phase and active phase. Okay, first stage again divided into latent phase and active phase. What is going on in the first stage means the cervix fully dilated. Okay, the dilated cervix only happening. The diameter is increasing. That is the process is going on in the first stage. In latent, and we already said we have latent and can you audible my voice? Voice audible ആണോ? മക്കളെ വോയിസ് ഓഡിബിൾ ആണോ? Okay, bless you. Okay, thank you. Okay, in first stage, let's say latent phase is there and active phase is there. Okay, the latent phase and active phase. Latent phase means contracting. That's the contraction become progressively the cervix dilates to 4 centimeter. Okay, already we said the first stage means that's a total dilatation will come. The total dilatation is 10 centimeter on the 2 inches. The total dilatation will come. In here, the latent phase contraction become progressively the cervix dilate to 4 centimeter. Latent and active phase are there in the first stage. Okay, first stage again we divided into two, that is a latent and a active. In the latent phase, it's a progressively the contraction become up to 4 centimeter. That is showing in the latent phase. And the latent phase average is the 8 hours in nullipara and 5 hours for multipara. What is this? Nullipara and multipara. Nullipara is a primary mother only nullipara. Okay. See the latent phase averages 8 hours is needed in the primary mothers. Okay. Primary mothers and multipara mothers are there. The primary mothers means 4 centimeter dilation at in the 8 hours. Okay. Inside the 8 hours only the dilatation becomes 4 centimeter. But in case of the multipara means within 5 hours they will complete the dilatation of 4 centimeter. Okay. First listen. First is 3 stages we said. First, second and third. Okay. In the first stage again divided into 2, latent and active. Okay. In the latent we are saying the cervix is full, the diameter about 10 centimeter. In the latent phase the contractions become 4 centimeter. Okay. In the 4 centimeter, primary mothers means 4 centimeters occur in the 8 hours need. Okay, within the 8 hours only the dilatation 4 centimeter in the primary mothers, but that is a multipara means 5 hours is needed for the 4 centimeter. Okay, then active phase. In active phase, the cervix become fully dilated and presenting part of the baby descend into the mid pelvis. Okay, in the active phase, in the first latent phase, already 4 centimeter dilatation is fine, and the 4 centimeter for a multipara means they need 8 hours for the 4 centimeter, but it's a multipara, nullipara means needed 8 hours, and multipara means that's only needed in the 5 hours. Then active phase. Active phase means the cervix become fully dilated. There only 4 centimeter, but in the first stage totally 10 centimeter dilatation is there. But in the latent phase, that is in the 4 centimeter, and in the active phase it is fully dilated and presenting part of the baby descending to the mild pelvis. The active phase average about, it's fully dilated in the active phase. No, balance 6 is there, total 10, 4 already happen in the initial stage. Then the active stage balance 6 is there. No, so the 6, the primary mother need 5 hours to dilatation in the 6 centimeter, and multipara mothers they need only 2 hours. Okay, in the active phase, initial and active phase. In the active phase, the mother nullipara means 5 hours needed for 6 centimeter dilation, and multipara 2 hours only for the dilatation in the 6 hours. Okay, then second stage of labor. Okay, second stage of labor means that is a expulsion only. Second stage of labor means that's a expulsion only. The baby moves out through the cervix and vagina to the bone. Okay, the second stage means the first stage is a dilation only. The second stage is the expulsion. Okay, the second stage is a expulsion. The expulsion means the baby move out through the cervix and vagina. The baby moves out through the cervix and vagina. That is the delivery processing only. That is a second stage expulsion. In the expulsion, we are seeing 2 hours for nullipara or primary. The primary mothers need 2 hours for the expulsion, and multipara they need only 1 hour. Okay, in here 2 hours for nullipara and multipara only 1 hour is needed. Okay, then third stage. Third stage begin with the delivery of the baby and end with the placenta membranes are expelled. This is also expulsion only. In here the expulsion, what is going on means placenta membranes are expelled. The stage is usually last only few minutes but may lead to up to 30 minutes. Okay, within we are saying within 20 to 30 minutes only this the expulsion timings. Okay, second stage expulsion, that's a baby moves out through the cervix and vagina to born. The baby coming out, that is the expulsion. In here the primary mothers means it's need 2 hours and multipara that's needed only in the 1 hour. That is the second stage. Then third stage, it's begin with the delivery of the baby, and it's end when the placenta and membranes are expelled. Placenta and members are expelled, that is the end stage. Okay, in this process the third stage only we are needed 20 to 30 minutes. That 30 minutes is the maximum time to expel. That is the 3 stages or 3 steps of labor. First stage, second stage and third stage. In first stage again we divided into 2, latent and active. Then second and third stage of labor. That is the 3 stages of the labor. Then the mechanism. Okay, in this mechanism already we have a little bit steps are there. How many steps you studied? Okay, the mechanism of labor. In the normal labor, there are series of changes in the positions and the attitude of the fetus. Okay, that's already we know, sir. It's a position and a attitude of the fetus. Position and attitude of the fetus to accommodate himself to the pelvic to pass easily through the birth canal. The mechanism of labor. The mechanism of labor. In the normal labor, there are series of changes in the position. The fetus having the series of changes. One time is the vertical, and that's the prim wise. That's some changes will occur. The changes, all the changes are, and it's series only, not at all like one change is happening in the last and one is in the first, not at all like that. It is in the series wise only the changes will coming. Okay, the pelvic pass easily through the birth canal. That is going on. In the normal labor, there are series of changes in the position and attitude of the fetus to accommodate himself to the pelvic to pass easily to the birth canal. That is the process is going on. So the process are engagement, descent, flexion, internal rotation of head, extension, external rotation of and expulsion. That is the one way. Okay. Another one side means engagement, descent, flexion, internal rotation of head, crowning, external rotation of head, restitution. That is the expulsion of head. Like that only that will come. First we can see engagement. Okay. Engagement is the greatest diameter of the fetal head passes through the pelvic inlet. Okay, engagement and easily and a single word only I am explaining. Okay, The greatest diameter of the fetal head passes through the pelvic inlet. The engagement means the greatest diameter of the fetal head passes through the pelvic inlet. That is the engagement we are saying. Then descent. Movement of the fetus through the birth canal during the first and second stage of labor. The movement of the fetus through the birth canal during first and second stage of labor. Then third flexion, the chin of the fetus move toward the fetal chest, which reduces the fetal head diameter from nearly 12 to 9 centimeter. Okay, the first one, the greater diameter of the fetal head passes to the pelvic inlet. Okay, that is the engagement. The greatest diameter of the fetal head is ready to pass. Okay, that is the first one. Second one, movement of the fetus through the birth canal during the first and second stage of labor. Okay, in the first and second stage of labor, first stage of labor means that is fully dilation. The second one is the expulsion. In dilation and expulsion times, the fetal movement in the birth canal, that is the design. Then flexion is the chin of the fetus move towards the chin of the fetus move towards the fetal chest, which reduce the fetal head diameter from nearly. Okay, flexion, the word meaning flexion we know. So what is flexion? Okay, the same thing only here also. The chin of the fetus move toward the fetal chest, which reduce the fetal head diameter from nearly. Okay, what is the most diameter is that from the diameter itself it is reducing. Then the fourth is the rotation of the fetal head until the longest diameter of the fetal head met the longest diameter of the maternal pelvis. The rotation of the fetal head until the longest diameter of the fetal head longest of the maternal pelvis. That means rotation. In this rotation, the fetal head until the longest diameter, and the same time the maternal pelvis also on the same diameter. Then next, the fetal head passes beneath the synthesis of pubis and passes out the birth canal, making the crowning. Fetal head passes beneath the synthesis of pubis and passes out the making of crowning. Then restitution after the head has delivered, the shoulder rotating intently to the pelvis. The shoulder and remainder of the body are delivered. That is the normally steps. First it is the engaged, then the fetal canal is first movement of the fetal, then the second one the chin and the body parts is flexing, then that's a fetal head longest diameter as relating to the mother's longest pelvis. The fetal head passes beneath the synthesis of pubis, restitution and shoulders and remaining part of the body and delwards it's come out. That is a simple word in the mechanism of labor. Okay, that's a normally what is dilatation is occur. After the dilatation is engaged, after it is the delivery of the baby and the placenta expel out. That is the normal mechanism. In main thing is going on in here means that is a management of first stage of labor. Management of first stage of labor. Okay, simple way only I written management. Okay, so one word wise only I written, that is the easy for you to catch. Okay, the management of first stage of labor, assessment, Management of first stage of labor. In the management of first stage of labor, mainly three steps are there. Management of first stage of labor, mainly three steps are there. First one, assessment. Second one, preparation and care. Third one is the partograph. First one, management of first stage of labor. First one, assessment. Second one, preparation and care. Then third one, partograph. That is the three main management in first stage: assessment, preparation and care, and partograph. In assessment already we know, so what we are assessing is the last 4 years. What you are assessing for a condition you are getting means, after that condition what are all the assessment you are doing. That's normally you know, but little bit we need change to up to the history obstetrical. Okay. Then first assessment, first one, history. The woman antenatal record review. Assessment, preparation and care, and partograph. In assessment, first point is a history, woman's antenatal record review, and antenatal care. Then complete history. That is the three ways: history, woman's antenatal review record, and clinic visit, and complete history. These are the three things we come under of history. Then second one, examination. Assessment, first one, history. Second one, examination. In examination, normally general examination. Under the general examination, pallor, edema, and abdominal scar. Okay, previously any history of the any cervical procedure, that things we are assessing. First history, second examination. In examination, general examination, pallor and edema and abdominal scar. Then third one is the vital sign. Okay, vital sign, BP, pulse, respiration and temperature. Assessment, first point, history. Second point, examination. In examination, general examination, pallor, edema and abdominal scar. Then vital signs, blood pressure, pulse, respiration and temperature. Then the next point is heart and lung assessment. Heart and lung assessment. If in the history there is no problem, means no need for the further investigation related to heart and lungs. Okay, first one, assessment, history. In history, woman's antenatal record, antenatal care and complete history. Then examination, general examination, general pallor, edema and abdominal scar. Then vital signs, then heart and lungs. The second one is the abdominal examination. In the abdominal examination, we are checking presentation and position. In abdominal examination, we are checking presentation and position. Then FHR. Second one is the history, first one, then examination. In under that, abdominal examination. In the abdominal examination, presentation and position is important. Abdominal examination, normally first one is the history. You know, so what are all the history we are asking to a antenatal mother. Then second one is the examination. Normally we are checking pallor, edema and abdominal scar. Then next one also normal thing only, vital signs. Okay, vital sign, BP, pulse, respiration, temperature. Okay, then we need to go first heart and lung examination. Then the second part, abdominal examination. Abdominal examination, first one, presentation and position. Presentation and position. Then fetal heart rate. Then uterine contraction. Abdominal examination, mainly 3 points are there: presentation and position, fetal heart rate, and uterine contraction. That is the 3 main points relating to the abdominal examination. Next, vaginal examination. In vaginal examination, see here, assessment, first we went history, normal history, whatever the history you are selecting, that's it. In examination, general examination, pallor and edema, and abdominal scar. This is the observation we can able to see. Then vital signs, heart and lungs, and abdominal examination. In abdominal examination, which we check the presentation and position, fetal heart rate, uterine contraction. Then we will go for vaginal examination. Vaginal examination, first one, presentation. Then is which area you are assessing, that's you mind it. Then you can able to write. Then vaginal examination, presentation, engagement, station, position. Presentation, engagement, station, and position. Okay. Abdominal examination, presentation and position, fetal heart rate, and uterine contraction. Then vaginal examination, presentation, engagement, station, and position. Then membranes. Presentation, engagement, station, position, membranes, consistency, dilation, and effacement. Consistency, dilation, and effacement. Vaginal examination, under the vaginal examination, presentation, engagement, station, position, membranes, consistency, dilation, effacement, and pelvic adequacy. The third point, first point history, second point examination, then the third point is the investigation. First point history, second point examination, under the examination, general, pallor, edema, abdominal scar. Then vital signs, heart and lung, abdominal examination, presentation, position, FHR, uterine contraction. Then vaginal examination, presentation, engagement, station, position, membrane, consistency, dilation, effacement, pelvic adequacy. And the last, investigations. In the investigation, urine and blood investigation. Urine investigation, protein, sugar, and ketones. Urine investigations, protein, sugar, and ketones. Then blood, CBC, RBS, grouping, and cross match. Okay, blood examination, little bit important. CBC, RBS, grouping, and the last one is a cross matching. Why we are doing cross matching here means maybe high risk patient is there, means we have to collect blood before the delivery. So we are doing cross matching also. Okay, CBC, RBS, grouping, and cross matching. Management of first stage of labor. The management of first stage of labor, mainly 3: assessment, preparation and care, and partogram. In the assessment, history, examination, and investigation. Then second one is the preparation and care. Preparation and care. Preparation and care, first one is the bowel preparation. Okay, bowel and bladder emptying. That is the first one only, preparation. Then encourage the empty the bladder. Okay, bowel and bladder is the first one. Why we are doing this process? Bowel and bladder emptying means prevent the fetal head from entering the pelvic brim, empire descent to the fetal head. Okay, in case of the bladder is filled means at the time little bit dislocated is occur, so we need to prevent that kind of the problem. So we are doing bowel and bladder emptying. Then nutrition, preparation and care. First one bowel, and second one bladder, third one nutrition. In the nutrition, what kind of the nutrition we are providing means we will not give any nutritious food, but in case of that's having dry lips or other dryness is feeling means at the times ice cups, little bit drop of water, pineapples or ice cube, keeping the lips like that we are applying and reduce the dryness. Preparation and care, first one bowel, then bladder, nutrition, and fourth one is the perineal. Preparation and care, first one bowel, second one bladder, then nutrition, then the perineal. Okay, in the perineal, let's say shaving only the process is going on in the perineal. Then position, fifth one is the position. In the position we are checking presentation, engagement and fetal condition. Presentation, engagement and fetal condition. Okay, preparation and care, bowel, bladder, nutrition, perineal shaving and position. It's the 5. Sixth one is the pain relief. Pain relief is the sixth one. Preparation and care mainly bowel, bladder, nutrition, perineal shaving, position and pain relief. As the sixth one is the pain relief. In case of severe pain means will administer analgesics. Okay, opiate drugs are normally that's a Pethidine IM only 4 hours per only we are applying that one. Okay, then inhalation analgesics or epidural analgesia, that's the pain relief. Perineal care, preparation and care, the preparation and care bowel, bladder, nutrition, perineal shaving, position and pain relief. That is the management in the first stage, second step. And the third one is the partogram, monitoring of the progress of the labor. Monitoring of the progress of the labor. That is the partogram work is going on. Let's say well-being of the fetus, well-being of the mother and progress of the labor. Well-being of fetus, well-being of mother and progress of labor. That is the 3 steps going on in the monitoring of the progress of labor. Well-being of fetus, well-being of mother and progress of labor. Okay, first we need patient information. First we need patient information. And that's normally history collection, identification data we are collecting, no? Same like that only here. Name, gravida, para, hospital number, date and time of admission, rupture of member, like that history we are collecting or information we are collecting. That is the first one. Then condition of the fetus. In condition of the fetus, FHR, membrane, liquor. FHR, membrane and liquor. The third steps, monitoring of the progress of the labor. It is depending upon the well-being of the fetus, well-being of the mother and the progress of the labor. In first step here, patient information. Then second one, condition of the fetus, FHR, membrane and liquor. Then third one is the progress of labor. Okay, progress of labor, cervical dilatation. cervical dilatation, descent and contractions, descent and contractions. First one, patient information, condition of the fetus, patient information, condition of the fetus, then progress of labor. Progress of labor in that cervical dilation, descent and contractions. Then condition of the mother. What is the mother situations? The mother will apply medications, vital signs and urine. Medication oxytocin 30 per minutes and IV fluids. Medication oxytocin and drugs and IV fluids. Then vital signs, BP we are checking 4 hours. Okay, the BP is how we are marking BP means arrow wise only we are making BP within 4 hours intervals we are taking. Then pulse per 30 minutes and the dot wise only we are marking the pulse. Then temperature 2 hours per once we are checking the temperature. Okay, in the third, monitoring the progress of labor. In that we depend upon the well-being of the fetus, well-being of the mother and progress of the labor. In that first we are collecting the information of the mother, then condition of the fetus, progress of the labor and condition of the mother. In condition of the mother, first medications, then vital signs and urine. That is the 3 things we are checking in the condition of the mother. In the progress of the labor, cervical dilatation, descent and contractions. That is the first stage of management. Management of first stage, 3 steps: assessment, preparation and partogram exam. In assessment, history, general examination, abdominal examination, vaginal examination, pelvic examination and investigation. Preparation and care, bowel, bladder, nutrition, perineal shaving, position and pain relief. Then the last one is the monitoring of the progress of the labor. It's depending upon well-being of fetus, well-being of mother and progress of labor. And that's first patient informations, then conditions of the fetus, progress of the labor. Inside the progress of the labor, cervical dilatation, descent, contractions, then condition of the mother. First one, medication administration, vital signs and urine. Then second stage of labor. Second stage of labor. In second stage of labor, here also 3 main steps are there. First one, preparation, then observation, conduct of delivery. First stage already we know, that is the dilatation process only. The second one is the expulsion. Okay, in here first one preparation, second one observation and third one is the conduction of delivery. In preparation, maternal position is important one. Okay, maternal position is important one. Why we are saying maternal position is important means will not allowed to sit, otherwise we will not promote to do in the supine position. Apart from the supine position, we are allowing the patient to sit semi-furlose and legs folded, which are all the positions is feeling free to the antenatal mother, they can use. But in supine position, we are not promoting. Okay, so little bit respiratory problems will come. So we are avoiding the supine position. Then second one is the perineal cleansing. First one, preparation. In first preparation, maternal position is the first preparation. The second one is the perineal cleansing. Okay, perineal cleansing means that's a cleaning. Okay, the cleaning, which are all the area we are cleaning before the delivery. Lower abdomen, vulva, anus, upper thigh with antiseptic solution and stopped to create a sterile field. Okay, what is going on there means totally we are clean. Okay, from the lower abdomen to the anus area, neatly we are cleaning with antiseptic solutions and make that part as a sterile. That is the process is going on in the second stage. Then second one is the first one preparation. Under the preparation, two steps are there: maternal position and cleansing. Cleansing or cleaning. Okay. Then second step is the observation. In observation, maternal conditions we need to observe. Okay, maternal conditions we should assess. Okay, maternal conditions like emotional conditions. Okay, maybe first delivery and all the primary mothers means maybe they have some emotional stress or something like that is happening. So first of all, we need to observe the emotional condition. Maybe pain is started, it's a prolonged pain leading to some problems also coming. So emotional conditions, then pulse checking and blood pressure checking. Observation, present preparation, observation and conduction of delivery. In first one, preparation, maternal position and cleansing. Then second one, observation, emotional sides of the mother, then pulse and blood pressure. That is the three main observations. Then fetal conditions, uterine contractions, and last one is the progress of the descent. In here, observation, maternal conditions is the first one. Under the maternal conditions, emotions of the mother and pulse and blood pressure. That's the three is under of maternal conditions. Then fetal conditions. Fetal conditions, FHR we need to check. Any variations will come in the FHR or not. Then liquor. Liquor is adequate or inadequate. We need to check. Then the next point is a uterine contraction. Fetal condition 1. Another point is a uterine contractions. Under the uterine contractions, strength, duration and frequency. The strength of the uterine contraction, duration of the uterine contraction and frequency of the uterine contractions. Second stage of labor, preparation, observation and conduction of delivery. Preparation, only two steps, that is a maternal position and perineal cleansing. Second one, observation. Under the observation, first point, maternal conditions. Under the maternal conditions, we could understand emotional side of the mother, then pulse and blood pressure. Then the second point is a fetal condition. We are checking FHR and liquor. Then uterine contractions, strength, duration and frequency. Then next point is the progress of descent. Every 30 minutes we will check the progress of the descent. Okay. Then the third step is a conducting of delivery. Second stage of the labor, main one is the third step, that is a conducting the delivery. First preparation, second observation, third one is the conducting of delivery. That's the conducting of delivery. In conducting of the delivery, delivery of the head. First one, delivery of the head. Then delivery of the anterior shoulder. Delivery of the head, delivery of the anterior shoulder, delivery of the posterior shoulder and delivery of the trunk. Second stage of management. The third one is the first one, preparation, second one observation, third one conducting of the delivery. In the conducting of the delivery, first point, delivery of the head, then delivery of the anterior shoulder, posterior shoulder and delivery of the trunk. That is the 4 points. Okay, then the last one is the clamping and cutting of umbilical cord. Clamping and cutting of umbilical cord. Okay, delivery of the head, anterior shoulder, posterior shoulder, and delivery of the trunk. The last one is the clamping and cutting of the umbilical cord. Okay, after delivery we need to wait 10 to 15 seconds before clamping and cutting the cord. In between 1 to 2 centimeters we can clamp and cut the cord. We need to check the arteries and veins also. Okay, that is the clamping and cutting of the umbilical cord. The second stage of labor management, last point is a conducting the delivery. In that, delivery of the head, delivery of the anterior shoulder, posterior shoulder and trunk, and last point is a clamping and cutting of the umbilical cord. Okay, then the last one is the third stage management. Then the third stage of management. In the third stage of management, first one is the delivery of placenta. Delivery, third stage management. First one, delivery of placenta. Then second point, examination of placenta and perineum. Examination of placenta and perineum. Then repair of episiotomy. Repair of episiotomy. First one, delivery of placenta. Second one, examination of placenta and perineum. Then repair of episiotomy. That is the 3 main steps in the third stage of labor. Okay, in the delivery of the placenta, we have 2 stages are there. First one, separation of the placenta from the wall of the uterus. Okay, first one, separation of the placenta from the wall of the uterus. Second one is the actual expulsion of the placenta. Delivery of the placenta, 2 ways are there. First one, separation the placenta from the wall of the uterus. Second one is the expulsion of placenta. Then second one, examination of the placenta and placenta examination. Then second one is the perineum. Examination of the placenta and perineum. Already placenta we collected. In the perineum, next we can assess. Then perineal region, vulval outlet, vaginal canal and cervix. Okay, in the examination we are checking perineal region, vulval outlet, vaginal canal and cervix. These are the areas we are observing. Any bleeding is there, otherwise any other problem is related, any infection level is possibility is there or not. That's kind of things we are checking. Third stage of labor, delivery of the placenta, examination of placenta and perineum and repair of episiotomy. In first stage delivery of the placenta, 2 ways are there. One is the separation from the uterus. Second one is the expulsion. Then second one is the examination of placenta and perineum. Placenta examination. Then perineum, we need to check perineal region, vulval outlet, vaginal canal and cervix. Then the last one is the repair of episiotomy. The third stage, last step is a repair of episiotomy. First one, suture. That is the first one we are checking, suture only. The suture, as soon as possible we need to do the suturing in the case of episiotomy. Why we are doing as soon as possible the suturing means prevention of the bleeding. Okay, bleeding prevent only the main aim to doing suturing as soon as possible. Then the repairing we are doing in the 3-layer technique. 3-layer techniques wise only we are doing the repair of episiotomy. Okay, first one is the vaginal mucosa. First, we are doing the suturing in the vaginal mucosa. Then second one, perineal muscles. First one, vaginal mucosa. Second one, perineal muscles. And the third one is the perineal skin. Repair of episiotomy. The suture is the repair of episiotomy. As soon as possible, we are doing the suturing because prevent the bleeding. And the suturing, we are using 3-layer technique. First layer is a vaginal mucosa suturing, then perineal muscle suturing, then perineal skin suturing. As a single suture wise, we can't able to do. So the 3-layer techniques: first layer vaginal mucosa, then perineal muscles and perineal skin. Then next is the reduced post-perineal pain. Reduced post-perineal pain. Already post-perineal pain are there, but it's reduced. Try to reduce by the medications. Repair of episiotomy, suture, the 3-layer techniques we are using, and reduce the pain of the perineal side. Third stage of labor, delivery of placenta, examination of placenta and perineum, and repair of episiotomy. These are the management of labor, first stage, second stage and third stage. Finished. Hi. Ashwin. Anjana. Abin. Sneha. Varsha. Aishwarya. വൈൻഡ് അപ്പ് ചെയ്തോട്ടെ? എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടോ? If any doubts? Shall I wind up? Nimisha and Anusha. Hi, Nimisha and Anusha. Abhirami, Varsha, Nimisha, അനുഷ. എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടോ? ശ്രുതി. എന്തെങ്കിലും ഡൗട്ടോ എന്തെങ്കിലും ഉണ്ടോ? I miss you all. ഗാനം ഉറങ്ങിയില്ല. ഞാൻ വിചാരിച്ചു ഗാനം നീ ഉറങ്ങിക്കാണുന്നു. എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടോ? കേട്ടതിൽ വെച്ച് എന്തെങ്കിലും ഉണ്ടെങ്കിൽ ചോദിച്ചോളൂ. ഹായ് ജോസ്മി ആൻഡ് രശ്മി. ജോസ്മിയുടെയും ആർദ്രയുടെയും കൂടെ ഡാൻസ് ആയിരുന്നു കേട്ടോ ഞാൻ കണ്ടത്. രശ്മി. അയ്യോ. ഓക്കെ ആണോ? ഞാനിപ്പം ജസ്റ്റ് കുറച്ച് സമയം കൊണ്ടൊന്ന് ജസ്റ്റ് ഒന്ന് നോക്കിയിട്ട് വന്നിട്ട് പറഞ്ഞതാണ്. അതുകൊണ്ട് എനിക്കും അറിയാം അത് ഇലാബറേറ്റ് ആയിട്ടൊന്നുമല്ല, ജസ്റ്റ് പോയിന്റ് മനസ്സിലാക്കാനുള്ള ആ ഒരു ഇതിൽ നോക്കിയാൽ മതി നിങ്ങൾ. വർഷ പഠിച്ചു കഴിഞ്ഞോ? കാവ്യശ്രീ വർഷ പഠിച്ചു കഴിഞ്ഞതാ? നിങ്ങൾക്കൊന്നും പറയാനില്ലേ? ഒന്നും ചോദിക്കാനും ഇല്ലേ? ഒന്നുമില്ലേ? എങ്കിൽ ഞാൻ വൈൻഡപ്പ് ചെയ്തോട്ടെ? ആണോ? ഗാനെ, ഇനി പേപ്പർ ഏതെങ്കിലും പോയിട്ടുണ്ടെങ്കിലും മോശമാണ് കേട്ടോ. ഇതുവരെ ആരും അറിയില്ലായിരുന്നു, നമ്മൾ മാത്രമേ അറിയത്തുള്ളായിരുന്നു. ഇനിയിപ്പോൾ എല്ലാവരും അറിയും. ഗാനം നന്നായി പഠിക്കും, എനിക്ക് ഉറപ്പാണ് ഗാനം പഠിക്കുമെന്ന്. ഗാനെ ഇനി പേപ്പർ പോയെന്ന് പറയാൻ പറ്റൂലേ? ഇല്ലടാ, ഫുഡ് കഴിച്ചില്ല, ഫുഡ് കഴിക്കണം. കുഴപ്പമില്ല, ഗാനം നന്നായിട്ട് പഠിക്കും, ഉറപ്പാ. നാലെണ്ണല്ലേ ഉള്ളൂ, 4 പേപ്പറല്ലേ ഉള്ളൂ. ഇവിടെ ഉണ്ട്, ഇതിലെ ഓടി നടക്കുന്ന. ഇടയ്ക്ക് ഇവിടെയൊക്കെ വന്ന് നോക്കിയിട്ട് കുറേ സൗണ്ടൊക്കെ ഉണ്ടാക്കിയിട്ട് പോയി. ഇപ്പം അകത്തൂടെ ഉണ്ട് ഓടിക്കളിക്കുന്നു. ഇങ്ങനെ ഓടിക്കളിച്ചുകൊണ്ടേ ഇരിക്കും, അതുകൊണ്ട് ഇപ്പം അകത്താണ് ഉള്ളത്. ഓ ആയിക്കോട്ടെ, ഞാൻ പറയാം വാവയോട്. മാമ വിളിച്ചാൽ വരത്തില്ല, അതുകൊണ്ടാ. നിങ്ങളൊക്കെ ഹോസ്റ്റൽ ഫുഡൊക്കെ കഴിച്ചതല്ലേ? ഇനി എന്താ പരിപാടി? ഇനി ഉറങ്ങാനാണോ? അല്ലെങ്കിൽ ഇനി എന്തായാലും നടക്കൂലല്ലോ അല്ലേ? ഇനി പോയി കിടന്ന് ഉറങ്ങി തന്നെ. നല്ലോണം ഉറങ്ങി നല്ലോണം പഠിച്ചോളൂ. നിങ്ങൾ എം.എ.യിലോട്ട് ഗ്രൗണ്ടിൻ്റെ അടുത്തൊക്കെ പോവാറുണ്ടോ? ശരിയെങ്കിൽ ഞാൻ വൈൻഡപ്പ് ചെയ്യാണേ. അപ്പോൾ ഓക്കെ, താങ്ക് യു. എന്തെങ്കിലും ഉണ്ടെങ്കിൽ ചോദിച്ചാൽ മെസ്സേജ് ചെയ്യുക. എന്തെങ്കിലും ഡൗട്ടോ ഏതെങ്കിലും ടോപ്പിക്ക് സിമ്പിളായിട്ട് വേണമെന്നോ എന്തെങ്കിലും ഉണ്ടെങ്കിൽ ചോദിച്ചാൽ എനിക്ക് മെസ്സേജ് ചെയ്താൽ മതി. എക്സാം ആയതുകൊണ്ടല്ലേ? ഏതെങ്കിലും കാരണം ഏതെങ്കിലും ടോപ്പിക്ക് ടഫായിട്ട് തോന്നും എന്തെങ്കിലും ആണെന്നുണ്ടെങ്കിൽ എനിക്ക് മെസ്സേജ് ചെയ്യ കേട്ടോ. ഇല്ല വർഷേ, ഞാൻ കഴിച്ചില്ല. നിങ്ങൾ കഴിച്ചില്ലേ? നിങ്ങൾ ഫുഡൊക്കെ അടിച്ചിരിക്കുകയല്ലേ? നിങ്ങൾ കിടന്നുറങ്ങുക എന്നുള്ളൊരു ഇതിലല്ലേ ഇരിക്കുന്നത്. എനിക്കിനി ഫുഡ് കഴിക്കണം. എന്തെങ്കിലും ടഫായിട്ട് തോന്നുകയാണെന്ന് വിചാരിച്ചാൽ എനിക്ക് മെസ്സേജ് ചെയ്താൽ മതി. ഓക്കെ. എന്തെങ്കിലും റിസർച്ചോ അഡ്മിനിസ്ട്രേഷനോ ഏതെങ്കിലും വേണമെങ്കിൽ പറയാൻ. ഇതേപോലെ നിങ്ങൾക്ക് പറ്റുന്നൊരു ടൈം പറഞ്ഞാൽ മതി, ഞാൻ വന്നിട്ട് പറയാം. അപ്പോൾ ഓക്കെ, ബായ് എവരിബഡി. ഗുഡ് നൈറ്റ്. അഭിരാമി ഗുഡ് നൈറ്റ്. ഗാന, വർഷ, മിസ് യു ഓൾ. റിയലി ഐ മിസ്സിങ് യു പീപ്പിൾ. നിമിഷ, എല്ലാവരോടും ബായ്, ഗുഡ് നൈറ്റ്. ഗുഡ് നൈറ്റ്.